Republican moderates in the House tried to roll out their own health care reform plan this morning. They are opposed to ending the tax exclusion on employer-sponsored health benefits. Do you see your plan being complementary with theirs at all, or are you at loggerheads?
I can't answer that. Maybe some of the guys from the House can answer that.
Sure. We're going to have many ideas coming from Republicans. Republicans are going to be putting out a number of different ideas on how best to solve this problem, and you're going to see those rollouts occur. I've talked with Mark Kirk, who's the primary author of that plan, and there is so much we agree on how to move forward with health insurance reform. We believe that the tax exclusion penalizes and discriminates against people who don't get health care from their job. And we also think we ought to reflect the 21st century workforce, which is people change their jobs. So we're simply saying, let's transfer that tax benefit from being attached to your job to being attached to each worker. At the end of the day, people will get a net tax cut out of that. At the end of the day, people will have more freedom of choice, and if they like what they've got, they can apply that tax benefit to what they already have and keep it.
And let me just add one thing. We might have sort of gone over this too quickly. This plan is budget neutral. This plan does not require an additional dime in taxpayer investment to cover 100% of the American people. It's absolutely essential on our part that we create a healthcare reform model that doesn't rely on more money going into the system. We've got to make sure that the architecture of what we design is sustainable for not just the increase in the population, but the ebb and flow that we're going to find through breakthroughs in technology and healthcare in the future.
Let me make one point on sustainability, because it's a question you have to ask no matter whose plan's out there. If you take everybody and just put them in an insurance plan, with insurance rising at 7.2% per year, are we sustainable? No. If you have a government-run plan and you allow the prices to rise at 7.2%, is it sustainable? No. We are not competitive globally. So you have to have a plan that looks at the sustainability of it in an area where we can afford. Healthcare inflation should not be as high as underlying inflation. If anything, it should be less because of efficiencies and technologies. What we have is a third of the money that's being spent in healthcare not going to help anybody get well and not preventing anybody from getting sick.
Senator, could one of the senators comment on where this fits in terms of the bipartisan track that at least is being attempted in the Senate with Senators Grassley and Davis?
Sure.
Sure. It is absolutely consistent with it. I mean, we're all working toward a similar goal, which is to change health care this year and to make sure everyone can afford health insurance. The advantage of the Burr-Coburn proposal in the Senate, along with that of the members of the House, is it injects powerful, different ideas into the debate. So we'll be having, for example, there's a breakfast tomorrow morning with about 22 bipartisan members of the Senate who will be considering different ideas and hearing from Peter Orszag, who's expressed concern in his writing about the Medicaid program's effect on states that Tom and Richard have talked about. So this puts Republican ideas into the middle of the fight in the debate about how do we do the best job for individuals, and we hope Democrats are impressed by the power of the ideas.
Also on policy, are there any government federal mandates as a part of this plan?
One, there is a minimal basic plan, which is the lowest FEHBB plan. That's the only mandate.
Everybody is required to
if you offer a plan, we leave most of this to states. In other words, we really believe in the 10th Amendment, and we really believe there are 50 different areas out there where they could experiment. But what we do is we set it up to allow states. We don't mandate that any state has to do any of this. But they're all going to want to do something, and what we're going to do is create the freedom for them to do what is best for their state. Look how many states are struggling trying to get through CMS to get a program to fix their Medicaid. I mean, it's ridiculous. They got to come ask Washington so they can do what's smart for their states. So what we've done is we've said, here's ideas, here's incentives. If you fix tort reform, here's some more money. We don't tell you how you have to fix tort reform. We just say if you'll fix tort reform in your state, where you take some of the $200 billion we're spending a year on tests that nobody needs, and you'll change that, we'll give you more money in terms of your Medicaid block grant or Medicaid assessment, the $5,000 per family that'll come along with the $5,700 tax credit per family. So the only mandate is we don't want anybody to be without basic coverage, but we also allow this to be able to go around the states that have 180 mandates that cause people to pay for something they're never going to use.
We also learned from Part D Medicare that when the American people are offered a choice, not everybody can choose. So we do allow states in those instances where somebody gets a tax credit, chooses not to opt into coverage, those states can auto-enroll them into a catastrophic policy. At the end of the day, we want to make sure that we can say to the healthcare delivery system, everybody has the means or the coverage to take care of their healthcare needs. Our attempt, again, is to reinforce the fact that we don't want to deliver primary care in the emergency room. We want to deliver primary care at a medical home.
Senator Coburn?
Yes.
If I can ask a question on another subject.
Outside of health care?
Outside of health.
Well, we'll take that question afterwards. Let's stay on health care here for a second.
Let me make one point to the question you asked. This is not a conservative plan. It's not a moderate plan, but I believe it's a credible plan. This plan provides universal access, it's zero cost, and it solves the unfunded liability of Medicaid. It does those three important things. And I would challenge, as this debate heats up next month in Washington, that when people lay out their plans, if they meet those three criteria.
Can I follow up?
Let me just,
sure.
okay, I'll just add to your, because you asked a big question. Mandates and things like that, universal coverage. Rather than having a federal mandate that everybody must buy health insurance, we believe giving the states the tools and the incentives to have auto enrollment will get us to that goal without mandating it on people. The state exchanges, which states have the freedom to set up, different options on how to make sure people with pre-existing conditions get health care, will have as one of their requirements the standard Blue Cross Blue Shield standard option that we in Congress have as one of the available benefits for people to choose from if they choose to get their health insurance through a state exchange.
The insurance industry has argued, though, that they need that mandate to do pre-existing conditions. Do you just disagree with that argument?
You know, we have the incentives to change insurance to truly being insurance. Right now, insurance is prepaid medical expense. You pay them money, somebody pays them money for you, they pay your bills. We're never going to get out of our hole until we manage chronic disease. And so what we do is we disincentivize cherry picking in this bill. It becomes painful for an insurance company to not cover somebody who has a chronic disease because they're going to pay for it anyway, if in fact the state utilizes this exchange method. It's called risk readjustment. Now, none of the insurance companies want us to tell them how to run their business. We don't want to tell them how to run the business. But what we recognize as a national priority, unless we're going to incentivize wellness, unless we're going to incentivize prevention, unless we're going to incentivize the management of chronic disease, we aren't going to be able to afford any health care, whether the government runs it or it's in the private sector. So we want to set up the competition so that by managing chronic disease, an insurance company actually makes more than ducking the patient with the chronic disease. And that's what we've done. Yeah, everything takes time. Setting up a government plan and then showing how incompetent it's going to be is going to take time too.
Gentlemen, quick question about the tax incentives. A large portion of this country has employer-based coverage that's substantially more, costs substantially more than, I think, $5,900. Is that what the tax credit?
$5,700 is the credit, and that credit can be used to access health care or to pay the tax consequences that might exist from now making the health benefits supplied by an employer taxable in income. Well, it doesn't take a very tough mathematical calculation to say that $5,700 covers the tax consequences of an employer-provided portion of health care benefit up to close to $17,000. That's well above the federal government's level of participation for federal employees.
So your contention is that for virtually no Americans will have to pay more for
That's right.
their health insurance?
That's exactly right.
Most people will get a net tax cut.
And the benefit is that for those of us that are federal employees where the federal government share is $11,000 to $12,000, we've got money left over that goes in a prevention account, and that prevention account can be used for anything that's not paid preventative or by the insurer or to cover eye care or dental care, which we do see as an important preventative piece of health care. The first time we've expanded one coverage to do all of them. Julie, I come to you. I just want to sort of give you the principles that guided us as we put this plan together, and it may answer some of the questions that some of you might still have. One, do we guarantee that every American can get affordable coverage? Yes. Two, do we demand that we get more value for our health care dollar rather than imposing a new tax or passing a new obligation to the future generations? I think when you have an opportunity to see that, you'll see that we do it. Do we transform the health care system so that we focus on keeping people healthy and well instead of only treating them when they get sick? Hopefully we've answered that question. Do we make health care coverage affordable for those with pre-existing conditions? We have the most novel approach on the back end to accomplish that anybody's come up with. 5, do we end the current discrimination in the tax code that benefits the wealthy and corporations but fails the poor and those who can't get coverage through their employer? I think we've answered that. And 6, do we guarantee that health care is accessible when people want it, where people want it, and by whom? I would tell you those are the 6 elements that every plan that's introduced will be held to. And I would tell you that Tom mentioned the 7th, which is it sustainable? Can we sustain this for the future? And I think the answer for ours is yes. Yeah.
One of the tenets of those in both parties is that if you're happy with what you have, you can keep it. Now, the argument the Republicans are making about the public plan is that everybody will end up in the public plan and that you won't be able to keep what you have. I think the argument that Democrats will make about your plan, and they've been making about the Wyden plan, or at least the original incarnation of it, is that if you get rid of the employer exclusion entirely, then employers will stop offering coverage. And again, you won't be able to keep what you have, that everybody will be dumped into the individual market.
That's just not the case. Look, employers under our plan will still be able to deduct the provision of health insurance to their employees off of their taxes. So employers still have the tax benefit to offer health insurance to their employees. That's point number 1. Point number 2 is they're not losing the tax benefit. The tax benefit is simply being transferred to them themselves instead of being attached to their jobs. One of the things they can do under this bill is they can dump their entire tax credit into their health savings account and pay premiums out of that health savings account, pay their out-of-pocket costs that they incur with their employer-sponsored plan out of their health savings account. And when you do the math, the vast, vast majority of Americans will be better off, will have higher wages and more money in their pocket to go toward health care or whatever they want it to go to. So we're simply saying, instead of discriminating against people who don't get health care from their job, and look, a lot of firms are dropping health insurance. They're cutting back on it. And so fewer and fewer Americans are actually benefiting from this tax policy, which was a 20th century relic. We want everybody to be treated the same. And we believe by giving this tax benefit to the person, they get to take it with them from job to job. It's not locked with their job. If they lose their job, they get to have the same tax treatment. They can take their health insurance with them. And then employees of firms get to choose. Do I want to keep what I have? Great, they can. And they have more tax money to deal with it. Or if they want something else, they can do that as well. So the individual has the tax benefit and the freedom to make their own choice.
Let me also point out one specific thing in the analogy that you used, comparing 2 plans. We've said throughout this that without addressing successfully a healthcare system that actually invests in prevention, wellness, and disease management, it's unsustainable healthcare. So we may have some similarities or some differences as to how we pay for what we're doing. But structurally, we reform healthcare. We transform it from one that triggers when you get sick to one that incentivizes healthy decisions. I'm not sure that anybody's on that pathway to successfully accomplish that. That's going to be the distinction between plans.
Senator Coburn, Matt Tobias with Modern Health Care, but you touched a little bit earlier on the Medicaid piece, and I'll open the question up to everyone, but if you can go a little more into that, talk about the relationship and how it would change between states and their citizens who are on Medicaid.
Well, let's say I'm on Medicaid, all right, and my family. Right now, in Oklahoma, I get a card, and I can go to about 55% of the doctors, primary care doctors, and about 25 or 30% of the specialists, and they'll see me. Now, I'm not a priority in their office because my payment rate is about 35% lower than what I could even get from Medicare or private insurance. So first of all, I'm limited in terms of the numbers that I have, and I'm not a priority when I come because my payment mechanism is way down the list. What we do is we say there should be no difference that any provider sees between the person with the best health care plan and somebody that needs our help. So all of a sudden we elevate a Medicaid patient to the same status that everybody else has. In other words, they don't know that you're a Medicaid patient because you got a health insurance card. So first of all, we take away the differential. The money, I guarantee you in Oklahoma, I can't remember, I think it was $190 million a year saved by the state of Oklahoma under this plan on their Medicaid. $1.9 billion over the next 10 years. I believe that's a number. I may have to correct that, have my staff correct that. Well, what would that do to Oklahoma in terms of helping with education if we had this plan in where we had them all covered on insurance? Remember, of this large group of people that aren't covered today, there is a segment, about 20 to 24%, that are people with chronic disease. But the vast majority of them are young and healthy people who don't have insurance. So when you add that large number and truly get an indemnified program that includes Medicaid and everybody else, all of a sudden the total cost for everybody goes down because you're putting the health into the mix. And we don't see any discrimination in terms of them being able to access the care they want and the doctor they want for their children or themselves as they enter the healthcare market.
Senator Coburn, I know you've met with the White House in the past few days or weeks. Where do you see areas of agreement in your proposal with things that are being proposed by Democrats?
Well, first of all, let me tell you where we don't see areas of agreement. I don't believe we need to tax one penny more to fix health care in this country. All you have to do is look at us compared to the rest of the world and look how much of our GDP we spend and how much we spend per person. The system has to be reformed. It's not more money. So we don't agree with that. Number two, we don't believe in a pay or play where you're going to tax the small business in this country and ruin job creation through pay or play. Now, if you think we can set up a national insurance plan over here and have all these insurance companies compete to bid for that, and it's at a better value and a lower price, why would anybody buy insurance where it's higher when they can buy it from the government? So that means the Lewin numbers are going to be absolutely correct. About 120 million people are going to go to a government plan. Except we know how we run health care, and we will not sustain it. And so the price will be that this will collapse on itself. It may not collapse originally, but look at Massachusetts. Where are they? Look at their model in terms of what it costs versus what they thought it was going to cost. And they're doing an insurance model as well. So I believe what has been outlined by my colleagues here, that a better way to go is the direction that we're going, which says let's get more value for everybody, and let's make sure everybody gets an access and has care that they need, and it's the same care.
Is there anything you do agree with?
Well, that we have a health care problem in this country and we ought to be addressing it, yes.
And that we believe that we all have to cover every American.
Yes.
We're going to get the hook because our colleagues.
Well, they're coming to
need
endorse the
their-
plan.
You want to do it?
So, Senator Coburn, can you please explain to me how, on a credit card rights bill, there's a provision that allows concealed weapons in national parks?
No. Easy. The 10th Amendment and the Second Amendment mean something in this country. Been blocked for 2 years from getting that amendment, even though it was promised by the majority leader that we would have a vote. Since we weren't going to have a vote, we added that to it. It's not about guns. It's about states' rights, being able to determine what is in the best interest of them, and it's about the Second Amendment. And it's not about bureaucrats telling Americans when their rights will be taken away. That's the answer to your question.
Thanks.
Thanks.
Thank you.